Good Monday evening. Today, Pfizer announced data from a trial that evaluated a third dose of the Pfizer COVID-19 vaccine in kids 6 months to under 5 years of age. 23 ABC's Brianna Polk spoke with a local doctor today and shares more about how this new data could potentially lead to toddlers being eligible for the vaccine.
Pfizer and BioNTech says that the third dose of the COVID-19 vaccine that was examined in this trial for the specific age group of children 6 months to 5 years of age was found to bring a strong immune response with a favorable safety profile similar to placebo.
When they did the first two vaccines, first two dosages, they found it wasn't as effective. So in their research, they gave the extra dosage, the booster, and it found it was a lot more effective. We do boosters for almost every vaccine. So I think it's very common to see, and I think it will be approved by the FDA.
Dr. Himmel Kothari from Mercy Hospital in Bakersfield says vaccine eligibility for toddlers could be on the way. On Monday, the FDA updated the schedule for its vaccine advisory committee. The meeting set for June 15th will discuss pediatric COVID-19 vaccines with the completion of an emergency use authorization submission.
The FDA has to do its due diligence and make sure this vaccine is safe. And they do look at all the data that Pfizer is going to submit. Moderna is going to be submitting something very similar as well for their second dose. So I would think shortly after that they will be an approval, at least Pfizer first, and I think Moderna shortly after.
Pfizer and BioNTech says that the third dose that was administered in the trial was well tolerated among over 1,600 children under the age of 5, which Dr. Kothari says could include mild side effects like low-grade fevers.
Kids that get the vaccine don't have any major side effects. You'll get the pain in the arm from where the shot went in. And beyond that, I don't think they saw too much more.
The third dose of the COVID-19 vaccine was given to the children in the trial at least 2 months after the second dose. And Pfizer says that a vaccine efficacy of 80.3% was observed in the analysis.
It shows that it is effective against Omicron. We're getting another surge right now, which is another variant of the Omicron right now. So I think having this booster on board can only help.
And Kothari adds that if the FDA Vaccines Advisory Committee agrees with Pfizer's findings, it is possible that toddlers could be eligible to receive the vaccine around the beginning of summer. And coming up at 11, we'll share more about how Pfizer says that no new safety signals were identified in this trial and how a pediatric dose was given based on the safety of kids. In studio, I'm Brianna Polk, 23 ABC News, connecting you.